Thanks. Okay, good morning. I want to welcome Omni for attending this press conference. Today is United Nations Day. And in 1945, on October 24th, the UN was born, and the mission was to bring countries together and address the world's problems. In the spirit of UN's vision, this morning I am making an announcement to address one of the world's problems, and that's the world organ and tissue donation shortage. Organ transplantation is relatively a new but very successful medical practice. It was actually in 1912 when Dr. Alexis Carrel was recognized with a Nobel Prize for his pioneer work in this area. There was actually no transplantation that were actually done during that time, but he had the vision and foresight to make it happen. The good news is that for the past 25 years, millions of people benefit by having their lives saved and living healthily afterwards. The bad news is that there's probably about 1 million people waiting for organ and tissue donations throughout the world, and every other minute, someone is dying in need of these gifts. So as we go through this press conference, there's probably 15 people that are going to die because they didn't receive an organ transplant. This issue needs a global stage to bring the much-needed medical technology and awareness, and then I believe that we can solve this problem worldwide. This morning, I am introducing, step-by-step, 7th campaign, and that the name of the campaign is SOS 1 Million, the World Student Torch Relay. I would like first to shed some background on step-by-step and my personal role in it. In 1992, I found out that I had terminal liver disease and had 2 years left to live. It was during this time that I started devoting my time to organ and tissue donations. Every day I would try and learn something new about this issue, and I was determined to find out as much as possible in Canada and worldwide. In 1994, the world and myself found out about Spain's successful approach in addressing this issue. I have been impressed with Spain's system ever since. I was fortunate enough to have a good general physician during this time, which led me to excellent care and in me eventually receiving a liver transplant in 1995. It's at this point that I want to make another point about this issue. There are presently over 4,000 people in Canada that are waiting for organ transplants. And from all my experiences since 1992, I have determined that the number is probably 10 times that amount. And so what I'm saying is that there's probably close to 30,000 people that should be on a waiting list as candidates to receive organ transplants. And I'll give my reason for this. I know how hard it is when you are told or you're told that you have some serious disease concerning one of your organs, and getting treated for any of these diseases is based on what kind of healthcare system we have here in Canada. Now, our problem is that if you're seeing a general physician, the wait time is extremely long before you see that specialist that you should be seeing, and the nature of your disease won't be probably diagnosed, and you'll probably never know that you could have been a candidate to become to be a candidate for the organ waiting list. And we have to look at our numbers. There are close to 100,000 people that are dying every year of heart-related diseases, 60, 70,000 people that are dying of diabetes, and close to that number of people that are dying of cancerous. And then there's other smaller figures of numbers of people that are dying of organ-related diseases. Now, how could it be that all these people, were they all notified that at one point or another maybe they could have been on a waiting list? And I think we have to look at this very seriously, because my belief is that instead of 44,000, I think there should be more closer to 25, 30,000 people that should be on this waiting list. So getting back to where I left off, shortly after my transplant, I created, step by step, a charitable organization. I humbly walked about 15,000 kilometers in total. From the first step that I took in 1997 in the first campaign to 100 million steps, and recently my sixth campaign in 2008, I and many volunteers brought this issue to the forefront by reaching the public, media, and government and making them aware about the importance of organ donations. During this period, we visited over 500 communities, and during this time, we participated in over 4,000 activities, including press conferences, provincial and federal health committees, school assemblies, church gatherings, community events, etc., etc., etc. Every day, I personally have engaged in countless debates, consultations, and research regarding this issue. I want to take this opportunity to shed light on the Spanish system, which I earlier talked about. It was during the first campaign in 1997 that I started talking about Spain's approach to their organ shortage. I continued talking about their system, and soon it was making national headlines. I would like to share some of my insight to get the record straight on this system and how Canadians feel about it. First of all, from all my experiences talking to Canadians about Spain's system, the response has been that they are in favor of this system. And I have literally talked to millions of Canadians throughout the last 12 years. There has been, however, a lot of misconceptions about Spain's system, including the name that's been used by critics and the media to describe it. And they use the name presumed consent. This term alone is misleading and destroys any attempt to accurately define this successful system. It puts a negative connotations when they see a headline that says presumed consent. It's like the government's going to own your body now, you know. And the accurate name is the Spanish model. And the reason for the Spanish model's success lies in combination with not only their system of opting out, but also all the medical advances, the way they manage their system, their attitude, their perception, and their desire to reach the full potential. And that's what's lacking here in Canada and most of the countries throughout the world. One of the most misleading myths about the Spanish system is that their government owns their citizens' body parts. And that is so far from the truth. In fact, the family is always approached before and asked for their consent before the process of organ donation continues. The reason they created the opt-out system, and it became law in 1989, the reason they created the opt-out system was to address the administrative shortcoming. And by creating this law, it was a very effective tool as well. And that only makes sense. In all my experiences going through Canada and talking to millions of people, almost everybody wanted to be an organ donor. And so if that was the case, why is Canada still suffering with one of the lowest rates? Obviously, one of the reasons is it's an administrative shortcoming. People either don't have the time, even though they have the desire, to either sign the card or become an organ donor. And then, as George Smitherman's panel 2 years pointed out, the donor card becomes useless. So why don't we address this if we know that this is part of the shortcoming? That's why the Spanish government and the Spanish people were smart enough to create an opt-out system. It doesn't take your freedom away. It just makes trying to save a life easier. That's why I support MPP Frank Klee's bill and Peter Cormo's. I support both their bills because both their approaches is to address this administrative shortcoming. Our government, provincial and federal, would be better off if they educated themselves in the Spanish system. It's really that simple. If they took the time to go to that country and you know, I mean, I'm talking about not a blue ribbon panel that would go there to study the Spanish system. I'm talking about a serious panel that is going there to get some answers. They would become educated and they would become armed with enough tools to help change the system here. So getting back to the announcement for today. Okay, so during these past 6 campaigns, the heart and soul of our campaigns were the students that participated. In 2004, if you all remember, Christopher Knowles, a 14-year-old boy, carried the torch of life across Canada. Christopher was in need of a liver transplant. And during his campaign, he inspired an army of students right across the country in thousands of different schools to get involved with this issue. In 2007, and this is just recently, over 100 students represented their communities by carrying the torch of life. So if we look at the time scenarios here, Christopher was 14 years old in 2004, and we were mostly visiting high schools. So all these students were in grade 9. So when we did the SOS 4000 student torch relay, we went back to most of these schools, and by this time, the students were in grade 12. And most of these students were so inspired by what Christopher did that they became educated on this issue. And one student was chosen in each city to be the torch representative, and sort of like an ambassador. And it was like taking on Christopher's role, because their role included talking to the media, talking to the public, doing photo ops, you know, and the whole community got behind this, what we called Student Torch Champion. And that was very successful. In each of the communities, these young champions inspired the public, media, and government, and usually made front-page headlines. On January 30th, 2009, these students are going to receive medals for their outstanding performances. It's going to happen here in Toronto, probably here in Queen's Park. The Torch of Life also shares a big stage with the students. On June 20th, 2000, the torch was officially lit up and carried across Canada as a symbol to encourage organ donations and give hope. Millions of people carried the torch, including thousands of Canadian politicians, celebrities, and one big celebrity, Pope John Paul II. The Pope blessed the torch on September the 5th, 2001 at 11:05 a.m. And I know that because when I looked at the video afterwards, it said the time, so I remembered the time. He called organ and tissue donations a genuine act of love and encouraged the entire world to become organ donors. He also urged me, and this is very important and very relevant to my announcement today, he also urged me to get the students involved when I was going back to Canada. But he didn't mention just get students involved in Canada. You know, if he would have said, look, just get students involved in Canada, I probably wouldn't be making this announcement today. But he said, get students involved. The torch of life has been blessed by many other religious and very important figures. They all share this vision with the torch that it will be on a long and prosperous journey. And, you know, during the last 8 years, the torch has been on a great adventure. You know, before I seen the Pope, we were at a sweat at an Aboriginal community. And one of the medicines men in the sweat, we brought the torch inside the sweat. And as he was looking at the torch, he started sharing a vision that somebody very important was going to receive this torch soon. And all he could see was white. And 2 months later, I was passing this torch to Pope John Paul II. And this torch has had so much history, and from people that have, you know, many events took place right here where people were literally with weeks left to live. And we brought the torch here to pray around the torch, and hopefully they got their gifts. And it happened so many times. People were witness to that. It happened so many times here and so many places throughout the world as well. And so I believe that there's been so much love and power that has been put into this torch, and it's over here, that the legacy of this torch is just evolving, and that it has to enter the world stage. That has to be the next destination for this torch. So that's why I'm ready to bring this torch to the world stage and begin this journey. On September the 5th, 2009, 8 years after the Pope blessed the torch, we will begin this 4-year journey around the world. This time, we're going to organize 1,000 students to represent 1,000 students from over 100 countries. In each country, we're going to do the same that we've been doing in Canada. See, we have a model already built for this. We're going to get the police involved for the escort. We're going to get the community leaders involved. We're going to get the political leaders involved. We're going to get the media involved. We're going to get community groups involved. And we're going to try and get the country's leaders involved to do photo ops with the torch. And the kids, the students, are going to be our leaders, because they're each going to represent their respective cities. And I'm confident that, you know, I am very confident that when we start this campaign, and we haven't yet decided whether it's going to be starting in Canada or United States. But regardless, I'm confident, and I'm saying this right now, and I said this in 2000 before I passed the torch to the Pope. I am confident that this torch is going to find its way to either President Obama's hands or President McCain's. I'm very confident, and I'm making that prediction right now. And, you know, we're also going to get well-known figures and celebrities. I'm sure when we go through California and Hollywood, then, you know, we're going to get all these celebrities that are going to do photo ops. We can and will excite the communities. Our goal will be to arrive at the finish line. And I know this is a big undertaking. Like, you know, like... people just don't wake up and say, or maybe they do. You know, I'm going to do a 4-year journey around the world. You know, and with all the challenges that this is going to take. But I got to remember, in 1997, I wanted to walk from Toronto to Ottawa. And you know, I was so excited to do this, and when I was in Toronto, I tried to see if I can see Ottawa from Toronto, which is impossible. And you know, I started thinking, Ottawa's a long way. Like, I don't know if I'm going to be able to do this. You know, and this was back in 1997. But the only way that I was going to be able to do this was to take that first step. And the only way I didn't drive myself crazy was to understand that I was going to do this step by step. That was the only way I was going to arrive in Ottawa. In that frame of mind and in that kind of attitude is how we did 5 other campaigns afterwards, and a total of 100 million steps from that one step. So from 100 million steps, which, you know, I have taken, and all these kids and the torch in the past 11 years, we are going to be on our way to 1 billion steps, because when we finish this, that's how many steps will have been taken. So it'll be from 100 million to 1 billion steps. Step by step, with students of the world and the torch of life, we now have the opportunity to save 1 million people and forever enrich their lives. So that ends this press conference. And Giorgio, I know you're the only one here, but if you wanted to ask any questions.
Yeah, so you think that the 2 bills from Cormosh and Cleese are very important to solve this problem, this administrative lack of communication, you would say?
Shortcoming. Yeah, yes. We have an administrative shortcoming. That's part of the problem. It's not going to solve the entire shortage. There's many other things that need to be done. But Mr. Cleese's idea of getting people registered during the time that they were applying for their licenses is certainly going to help it. And that's why I supported that bill. But I also supported Peter Cormos's bill, because in Peter Cormos's bill, it's more similar to the Spanish model, where, you know, if he had enough support here in the province, in the House, that a law would be passed where every Ontario would be already registered as organ donors. But I have to make it clear, because almost every media people that covered this story never mentioned that the family still has a part in that system. So, but what happens is, if Ontario ever decided to do the opt-out system here in Ontario, what that does is create automatic awareness, because everybody's going to be talking about it. Everybody's going to be talking about that they're already on this registry. So the much needed organ awareness education is automatically instated because this is being, you know, so it's actually solving 2 goals: the awareness goal and the administrative shortcoming. So once people in Ontario became educated about this law, they know that their family's going to play a part in it, and they know it's very simple to opt out, and they know the reason why it would be done in the first place. You know, I can guarantee you that if this ever got done, that there won't be this big outcry that everybody's been, or not everybody, that some of the critics, and there's only a few that have been saying that there would be. You know, if the Premier, if the Liberals decided to get behind Peter Cormos's bill and decided to install this opt-out bill, the only thing that's going to happen is that more lives are going to be saved.
What about the other provinces in Canada? What do you know? What kind of feedback you have from other provinces? What's happening for organ donation all over Canada?
they're all in the same place that Ontario is at. I've talked to all the health ministers from each province and all the premiers from each province, and they're in the same place. The reason why each government is a little unsure about this is because they're not entirely sure of how the public is going to react to this. So when they have this uncertainty or unsurety, you know, they are going to stay on the fence. You know, now in the past, when Mr. Cornwall has produced his bill, twice it didn't make it to the second reading, you know, and twice it didn't get proper hearing, and twice, you know, so I think that was the safe bet for the premier to do. Now, I did not support the George Smitherman's panel on their findings that Ontarians were not in favor of it because it was based on very flimsy research. You know, there was only 2,000 people that responded to their 4 months, $2 million panel, and most of these people responded through the internet. Most of them were paid. You know, did the public know that? I mean, the public did find out about that. So how can you base such an important decision based on such flimsy evidence?
And based on this, are you promoting, or did you already promote, or you want to promote another online petition from people, maybe sending email to their MPPs or the premier of provinces to push for this new law on organ donations? Are you going to promote something like this too?
Since day one, since 1997, that's all I've been doing is promoting that I've been saying that we can solve this shortage. But we can't just look at one part to solve it. The bill is an important part, you know, the system. It would tackle the shortcoming. But we also need to do other things. We need more retrieval centers in Ontario. There's remote areas where people are willing to donate their organs, but it's going to be impossible for their organs to get used because there's no retrieval centers to harvest them properly so that they can get to people. And people up north know that very well. I've been up there so many times, and yeah, and you know, and this is for other parts of Canada as well. So retrieval centers. Also, we still don't have enough heart dead donation surgeries going on. And that only came into play a couple of years ago, and we were urging that for the past 7 years. You know, there's many other things, and it's also going to be our attitude and perception towards this issue. That's why Spain has been so successful, is because they have a certain attitude and perception about this issue. They feel that, you know, they had a 96% success rate in finding organs for the people on their waiting list, and yet they want to shoot for 100. So they have that desire and that attitude to do it, and that's what is really needed here in this province.
Percentage.
Yeah, exactly. We have to understand that it doesn't cost anything to be an organ donor. You know, people aren't asked for money or to, and of course, if we're going to have more organ donations, we're going to need more facilities, more surgeons, more, you know. But I also want to point out, when I went to Spain, I did a very comprehensive study on the financial aspects, you know. And the bottom line was that the more organ transplants that Spain produced, the better off the healthcare economy is. Because if we look at our healthcare economy now, there's a lot of money that very sick people are dependent on, and that are candidates for organ donation. So if they receive their organ, then they get a healthy life, and they get back to work, and they start paying taxes. So it's almost like reforming welfare. And so, you know, the more transplants, the more surgeons you're going to have, the more investment. It's a great investment to make, not only for the sake of saving lives, but you're going to get a big financial return on this. And that's the other part that I've been urging the government to look at as well, because usually these things do come down to what's the price, you know. The price is that Any government, whether it's provincial or federal, will end up saving the healthcare dollar, much dollars in the healthcare system, and get people back to work.
Beautiful, George. We do one-on-one if you can.
Sure,
Okay
sure.
for you. Thank you, George.
Thanks, Joel.